How to diagnose the ACL tear? To diagnose the ACL tear, there are multiple modalities. First thing is, once the patient comes into the chamber, first we do the clinical examination. We check. There are special tests called as the anterior test, Lachman test. To that we help. This helps us to know whether there is an increase in the laxity of the knee compared to the non-injured knee. Then we advise for the X-ray. The X-rays helps us to confirm whether there is any associated bony injury along with the ligament injury. Then we advise for the MRI of the affected knee. MRI helps in confirmation for the ACL tear. It also helps us to know about the associated ligament injuries. Usually the ACL tear is associated usually with the meniscus and the chondral injuries. So the MRI will also help us to rule out these things. So once we confirm about the ACL tear based upon the clinical examination, X-rays and the MRI, once we confirm that it's an complete ACL tear, then the patient will require arthroscopic ACL reconstruction. If the patient is young, athlete, and if the physical demand is high, then they have to undergo ACL reconstruction as soon as possible, because if we ignore it for a long period, the patient will have a repeated instability. They might have a repeated injuries that might lead to the damage of the associated damages of meniscus as well as the chondral damages, which are difficult to treat.